My name is Mike Ullery. I was a photojournalist with the Troy Daily News, Piqua Daily Call, which then merged and became Miami Valley Today. Between the three newspapers, I was there nearly 30 years. I continue to do photography. I'm technically retired, but I'm not good at saying no. I'm lucky enough that I've been offered the opportunity to fly with Care Flight a number of times and document the flight nurses and the staff who work around Care Flight, and it's been one of the biggest thrills of my life getting to do that because they are very, very special people. The night before, there had been a structure fire in Piqua. People lost their home, and it was a rainy night. I came home, I wrote the story, did the photos, and typically then the following morning I will get on the phone and call whatever fire department and follow up, see if any new developments or anything. Well, this time my phone rang pretty early in the morning, and it was someone up at the fire department, and they said, "Hey, one of our cameras got wet last night. Could you stop by and take a look at it?" So I said, sure. I got in my car, started toward Piqua, and just about the time that I got out of our neighborhood, started to feel weak, tingly, an odd feeling. As I kept going, the sensation spread, and I could feel it getting up into my face and moving down into my leg. As I got into Piqua, I knew something was definitely not right. I'll get the Piqua Fire Department, go in and see what happened.
I've known Mike for probably close to 20 years as a representative for media here in Piqua. And that day, I was just leaving the parking lot. I was in the fire department pickup truck, just about to pull out of the parking lot when my phone rang, and I saw that it was Mike calling. So I stopped and answered the phone. He just didn't really make any sense. It was kind of odd for him. But I was able to make out that he was in the parking lot at the fire station. So I had to kind of figure out where he was. But then when I was able to find him, realized pretty quickly he was having some kind of a medical problem. We were able to identify that as a stroke pretty quickly.
Literally within a minute, there were two firefighter paramedics beside my car, and another minute there was a medic unit rolling around the corner to the back parking lot, and they took control right away, as they should, and they were amazing. They were I've known these guys for many, many years, and I've worked around them, but it's totally different to be on the receiving end of their care as opposed to observing them doing their thing with other people. They asked some questions, did blood pressure, all that kind of stuff, loaded me in the back of the medic, and immediately got me on my way down to UVMC. And I could hear all of the radio conversation, and they called a stroke alert. It was almost like something out of a movie. There was medical staff standing at the door with a bed, and they were ready to transfer me right away.
So the Premier Health Stroke Network includes a vast team of professionals caring for all different types of stroke patients. These individuals, of course, are available, but not only available, they are present at bedside, whether it be in person or on telestroke, which is the case in Mike's story. Once the emergency stroke team has done their assessment and evaluated the patient for any emergent therapies, they then turn the care over to our inpatient Neuro 1 team. The Neuro 1 team is comprised of both physicians and APNs, and all specialized in neurocare for an inpatient, non-acute consultation service.
So we were able to care for Mike here at Upper Valley. We do have Neuro 1 services, neurology services. We did not have to transfer him because we provided services here for neurology. Upper Valley is a smaller hospital, but we are able to care for patients here as long as they don't need any interventions. So we did not have to transfer Mike to Miami Valley Hospital.
I think we do a pretty good job at making sure to take the right course of action to treat stroke patients, and very big on the education part of it to make sure that the patients know what they need to know when they go home and give them the right resources. And I think we're pretty quick to respond to the stroke alerts and get the patient to imaging quickly and take care of things. So I think we do a pretty good job, and I'm happy to be part of it.
And I was told in multiple doctor's visits that anything that was going to go away could take up to a year to fully subside. Most everything has gone away. I still get a tingle in my leg now and then, just a little bit of numbness. My left arm, left hand is still numb. Again, I can still grip, I can still use it, everything. I consider myself very lucky that things turned out as they did. And
so I was able to follow with Mike outpatient in the stroke clinic. The first time he followed up, he was about 50% improved with his symptoms. He had returned to work, he was driving. And then I followed up with him again, I think it was about 3 months later, and he was doing even better. Symptoms were almost completely gone. I think he's continued to have a little bit of numbness and tingling in his hand, but his other symptoms had improved.
I thank the Piqua Fire Department and UVMC. I don't know whether it be their stroke staff or their ER staff, all of the above, for the fact that I can continue life